Wonderful. Well, I think I'll get started here. So I just want to take a few minutes and not take up too much space from the amazing speakers we have today. But I just want to thank everyone for coming out tonight. And I hope everyone is doing well and in good spirits. And, I really appreciate people coming out to yet another Zoom event. But I think tonight, we're so lucky to be holding this discussion around the themes of Kimami Bitsen, the meaning of empathy, an absolutely beautiful and thought-provoking film. So I'm with Story Money Impact. My name is Tamil Campos, and I'm calling in today as an uninvited guest on the unceded territories of the Musqueam, the Squamish, and the Tsleil-Waututh. And before I pass it to our amazing speakers, I just have a bit of housekeeping to do. First off, a warning that today's discussion may talk about some triggering subjects such as residential school trauma and drug poisoning. If you're feeling distressed or triggered, we do have wellness support and phone lines available. And so we have two wonderful counselors here today from the Indian Residential School Survivor Society, Yvonne and Gertie. And so we'll be posting their numbers in the chat right now, and they will be pinned to the top so you can access them at any time by scrolling up or just getting a hold of myself or any of the Story Money Impact team. And we're extremely grateful for them both here today with us to support us as we discuss these difficult themes. Today's discussion is part of Story Money Impact's Story to Action program. It's a 6-month program where we support impact strategies of 5 powerful films. Our program and our organization exists because we believe in the power of documentary to shift minds, hearts, and build community. If you want to learn more about our program or are interested in checking out some of our upcoming screenings, we'll post it in the chat. We'd also like to thank our funders for the program, InSpirit, CBC, TELUS Story Hive, Creative BC, Telefilm, the Canadian Media Fund, CMPA, and Picture Shop. I see that lots of people are coming in here, so we have a big crowd, and I'm sure I'm not the only one thinking this, but I would love to know who's in this room. So please feel free, introduce yourself in the chat and where you're coming in from today. And also just a note, you can put your questions in the Q&A box, and you can vote for the questions you most want to see answered. Today, we actually have an amazing list of partner organizations who helped promote this event. I'd like to thank the Simon Fraser University Office of Community Engagement, the Canadian Drug Policy Coalition, Mom Stop the Harm, the Nista Wiao Association Friendship Center, First People's House at the University of Alberta, Student Association of Keano College, the BC Association of Aboriginal Friendship Centers, First Nations Health Authority, BC Centre on Substance Use, the BC Centre for Disease Control, the Campbell River Division of Family Practice, and the Directors Guild of Canada. We'd like to say a huge thank you for promoting this event, but also just thank you for the work you do. Today's hour will consist of an opening prayer from Elder Francis First Charger. We'll then watch the trailer to the film to bring us back into the heart and the energy of this powerful and beautifully held film. And then we will have a conversation with Elmaya Tailfeathers, Dr. Esther Tailfeathers, Lori Eagle Plume, and Mel Basil, moderated by Chantal Bell Richard. We're so lucky to have such amazing and courageous speakers with us today. And so we look forward to listening, to learning, and in being inspired into action. And with that, it's my honor to pass the floor and welcome Kainai Elder Francis First Charger.
Good evening, everyone. Appreciate asking me to do the opening prayer and helping out what I could. When I started praying in my own language, is Blackfoot. When I finish praying, I'll say thank you. You take your right hand and put it towards your left where your heart is, and you say, more or less, you accept my prayer. It's the Western way, like amen. And I'll be praying for everybody and also the work you guys are involved in. Your jobs, all of you are well needed in the community. And also some challenges. And anytime that you'll be able to get through some of the challenges and that they come across, that you get strength and health. And also, of course, pray for your families and also your professions, that you'll be able to do the work in a way that'll help everybody, and also to be healthy and safe. And of course, I always pray for the pandemic, that that'll be taken away, and we won't catch it, and also that it won't spread anymore, and the new medicines will get rid of this and won't come back. Ayo istipat panikat pachum usko panikat kaki natri the piomo kaki ano ko kaki makoin uski ko kino kaki napin iski makaken khachina shin kaki nama shita pio kaki gatter piani kaki kaki kimma to natri the penu mata puama to switch sama om the people speaking ochishkana to out nach tak watch mushkaki anni taki xiko skam sukitu to ai ko muchapo kich kuchishaksa ka to simakomai ko chikaki hamit chuta pichistan o kiniko pa ka penika ko anika ko ta pisnikaki anni kaki asan stumna anni kaki ani ko tan sta pa the pis penika ki kuchisa ani ka ko khachita pita pinis ke mara chita pita pi o wa tu mini ko sta pis kenika shinika ki sho tsia kimma to sa na pi ai ki sto ki skona ta pis to ma ko pis ta pi no sto makaki o ke sa to ach bis ka sa ki o kam so ki patsa sa ki o ki spumu ki kimma to ki na pi I think I got him and Nikaki don't stick a Konikatsu, which guys will see Kakimo Paki. They take up on Mr. Panikaki, boy, Boyanikaki, no thought stuck a Kushai, Skim Kima to Kinaki, the Pin managed to be Kochi. Of course, what was supposed to a piece by Chocho, what book she much, oh, Kinikisaki. And Sagas to up, Shizaki that better Pianica, unwise could just to add marsh scratch, like no pocket, just to question Kimma to Satnat read. He's to Anakaki is to bad Pukaki. I get in the sum of Pinaki, Saki. They go high Kakimotokina, the bad Pilsnikaki, Sagapsuko is cooking and Xokapi, Moxuko, Mishamsoko Kaki. Oh, Coach Kamisho, Komistom Spinan, Kukinani. The Hokatesh so is okistom spinat. Ikakada Piamuchikaki. I need to go capsis, Gawach and Nanikaki, each art stachikaki, Sota pet pirksa kat sanikaki. I could oxani that could so taxi kaki mapia kimma to sanat read pick. I can also copy tago catching to the porto kimmato. Oh, Kito to a committee stop. Nipitam no course, Nishokos, no papis, Nichoka, Chishkos, Anikaki, Dokos, Simitato, Pustato, Pusukus, no Pokene. I just spoken at not Chichikois. Taki Tama, what it is to go at Tam and the higher Siko, a time before got up in a attack. Oh, come with the annex to watch Marky push him. Success at the sense of the Pilsen. Thank you.
Thank you, Francis.
This is home,
Welcome.
Ghana, otherwise known as Kainai, or the Blood Reserve. Nestled in the foothills of the Rocky Mountains, Kainai is the largest reserve in Canada. Beginning in 2014, fentanyl flooded the illicit drug trade on the reserve. This new reality has forced our community to approach addiction in radically different ways.
The difficulty was in convincing people that harm reduction is the route that we have to take.
By no means is it celebrating addiction, but what it does is it celebrates the lives of people without judgment.
Our group here is looking at expanding what we have to do to help our community heal.
There you go. I could could save a life.
It's very heart-wrenching when you go on a call and people are breathless.
And we can't sit back and expect things to change without doing the work.
Trying to get off these ox-80s by yourself, it's hard.
The next thing we want to do is address a detox facility on reserve.
History marks the Bloods as some of the fiercest, strongest people there ever was. And I want us to get to that point again. I'm happy.
We have a Blackfoot word that's called Gima Bibitsin, which means giving kindness to each other. Thank you. And that means also compassion for those who are suffering.
It's an amazing thing that they've done. And in my eyes, they're heroes.
Hi, everyone. Thank you to Francis for getting us started off. I'm really grounded here in this space, and to Tamo for the introduction. My name is Chantal Bell-Richard, and I'm going to moderate a conversation about this film with you tonight. So I just want to acknowledge that this is a challenging time for so many reasons, for so many people. And hopefully this is an inspiring conversation and doesn't take you too deep into anything terrible. And thank you for just taking the time to prioritize this conversation amid all of the competing priorities we have in our lives. I was really excited to see this film when it came out. I had spoken with Amaya over the years and knew that she was working on it. And congratulations on just such a beautiful piece of work. And we'll start with the introductions of who's here. So of course, Amaya Tailfeathers, who is the filmmaker and director of Gima Bibitsin. Hope I said that okay. Gima Bibitsin, The Meaning of Empathy. She is a star writer, director, actor from Kainai, and she is also Sami from Norway. And we also have her mom here, Dr. Esther Tailfeathers, who's born and raised on the Blood Reserve. She is, of course, as you would all know by now, a doctor. She spent a lot of her time and care working with her community on its response to the opioid crisis. Dr. Tailfeathers is currently a senior medical director focused on Indigenous wellness with Alberta Health Services. And we have Lori Eagleplume here, who I think is like a capital C caregiver, loving mother, grandmother, sister, auntie from Kainai. Her story of strength and recovery is featured prominently in this documentary. And I'm really curious to learn more from you about how you came to agree to put your life out there in this film. And then a little bit further away in another territory, we've got Mel Basil here with us tonight. He is coming to us from Wet'suwet'en territory. He is a Wet'suwet'en and Gitxsan man, father, storyteller, counselor, and activist. He is a very active member in his community and described as a long-term fixture at the Desilkent Friendship Center, where he still is right now. So he is passionate about witnessing his people rise. And just before we started tonight, he did mention that in their community, they are in the baby steps of introducing some of these harm reduction services that we're seeing in this documentary. So I'm really looking forward to what this brings up for you, Mel, your curiosities and questions and best practices that you're looking to learn from this space. I think just to start us off though, Maya, if you don't mind just telling us, how did you make the call to say like, okay, this is your community, you knew this was happening, but how did you decide, okay, I'm going to go for it and I'm going to put this story out there in documentary form?
Well, thanks to everybody, first of all, for joining. I think everybody's got Zoom fatigue, and it's really nice just to see that there's 232 people here tonight. And it's so nice to see everybody, these familiar faces, and you, Chantal, and Francis, thank you for the really, really lovely introduction and prayer. It was really nice to start this evening in prayer. Yeah, I guess I felt sort of compelled and obligated as a community member to document what I was seeing within the community. My mother was working on the front lines and witnessing so much. And I was hearing from her firsthand about her experiences as a physician and as a community member. And then, seeing the amount of grief that the entire community was experiencing. But what I was seeing often in the news media was this like portrayal of our community through trauma and tragedy lens, and there wasn't enough focus, in my opinion, on the hard work and the community mobilization that was happening, because I was seeing so many people volunteer countless hours of their time to meet and gather and try and find solutions. And it was like the outside world didn't know that that was happening. And so I felt obligated to document that so that the world could see the strength that exists within the community and the fact that our people have been and continue to try so hard to find solutions and are up against so many barriers. And I also felt like what was happening in Kainai was really revolutionary and was really radical. Harm reduction is such a contentious issue, you know, across the board, not just in our community. It's a contentious issue throughout the country. And what was happening in Kainai and what continues to happen there is pretty radical. And so I felt like I had an obligation as a filmmaker and as a community member to document all of that in hopes of creating something that could be used as a tool for dialogue. And in my own personal journey of understanding was like pretty steep. You know, I started making this film with a very limited knowledge of what harm reduction is. And by the time I finished, I felt like I don't know, like taking a PhD or something in harm reduction, just in sitting with so many people and learning from them. And so I felt like I wanted to be able to just offer audiences the opportunity to go on that learning journey with me, because I think there's such a broad misunderstanding of what harm reduction is and the many ways that it can be enacted within community. And yeah, so those were all the reasons I wanted to make this film.
And Dr. Tailfeathers, how did your daughter convince you to get you to be on film? You know, I feel like healthcare is a very private setting. Often, I'm sure there were all sorts of consent and conversations about that. But how did you agree to say, okay, my girl, I'll let you film me at work?
Well, she pitched the film to me and told me the whole storyline. And then after I said, "Oh, that's a really good idea, Maya, please go ahead and do it." And then she said, "Mom, can you be in it, please?" So we talked about it, and I said, you know, if you can shine the light on people in the community that are doing this work, because it's a collective, all of this is a collective, and it really needs to be shown that everybody lifts us, and one or two people can't do it themselves. So, you know, everywhere in the community there are people that you don't see in the film that have done a really good job in lifting this whole effort.
And Lori, I guess the same question for you. How did you agree to say, okay, I'm going to put my life out there? Like, that's a very vulnerable place to be for anybody to put their life out on a film, but particularly in talking really openly about your relationship with substances.
Well, for me, I was doing my regular visits and checkups with Dr. Tailfeathers. And when she had when she told me about what her daughter was doing and asked if I would, you know, meet with her and, you know, just to kind of tell her about my situation and my story, and I agreed. And once I sat with Maya, I really wanted to, at that time, I really wanted to help others, you know, because there was so much other like family close to me, friends who were still struggling with their addiction. And I thought, you know, even though it's just a little piece of me talking on it or whatever, I just wanted others to hear that, you know, that there is no shame in helping yourself, no matter how many times you relapse and all of that. And, you know, and especially with a lot of people were against the Suboxone, you know, all they would tell us, and like me and my wife, that it was just another addiction that we would be, you know, on for years. had a lot of negativity towards it. And I wanted to tell others, you know, it's not just another addiction, you know, Suboxone gave me my life back. You know, I was able to get back to normal, live a normal life, you know. And for that reason, I was able to take my niece and nephew and my nieces and nephews in, and, you know, raise them as my own, and, you know, just encourage others that, you know, there is hope out there, you know, not to give up.
Was it hard for you, Lori, to make the decision to say yes to a substitution therapy? Like, had you sort of internalized some of those teachings and opinions about opiate substitution therapies?
It was hard at first, you know, but see, like, I tried many times to quit on my own, and it was really hard. Like, it was hard for me, you know. A lot of people told me that there's people out there who were able to do it on their own without, you know, getting on anything to help them stop, you know. I tried, and it wasn't that easy for me and my wife, you know. And when somebody reached out and offered help, you know, helping hand to me, you know, I thought, okay, well, this is my chance. Let me see, you know, what they're offering. And Suboxone, I was afraid of it at first because of all the stories I was hearing, but once I got on it, you know, it wasn't that hard, you know. Others are stronger than others, you know. Everybody reacts differently. Everybody has their own opinion to it, you know. But I know a lot of people who I was able to help, you know, get on it. My daughter was one of them, and my son-in-law, you know, they relapsed several times, but, you know, I always kept helping them, you know, to get back on, and I would share that with others. And, you know, everybody has their own opinion. And, you know, for me, it was hard in the beginning, but, you know, further down the road, it was worth it. It was so worth it. And I would encourage it to others, you know, who are struggling with addiction right now, you know, try it, you know, will give you your life back.
Dr. Tailfeathers, on the part, you know, there's a lot of conversation about the abstinence model and then the harm reduction model, and how a lot of that came into Kainai through the opioid poisonings that have been occurring. And one of the things that struck me was when you spoke about these treatment beds and people were going to treatment and then relapsing and dying. How safe is it actually, like from a medical perspective, in this opioid circumstance we're living in, for people to go full abstinence mode?
It's actually unsafe, and it definitely depends on the of use and how long people have been using, but it's terribly uncomfortable. I mean, people that are withdrawing now, we have multiple substances on board. We have not only like fentanyl or heroin, we have benzos, and we have what people call side, so they take down inside, so it's methamphetamines as well. So the withdrawal picture is very unclear in terms of what are they withdrawing from. You're going to see the diaphoresis, cold sweats, the nausea, the vomiting, the anxiety, the pain, all of that. And it's very hard to expect somebody to try going through that for 7 to 10 days. And you know, especially with the withdrawal from other substances, I'm sure it's plain hell for people to try to get through withdrawals without help. And so our people were only lasting 3 days, even in the abstinence detox centers, and leaving. And the amount of organization that it took to transport as many people as possible into the provincial detox systems was really hard. And then they left, and then they were lost in the streets of Calgary, or, you know, where they were transported to. They didn't even really make it to treatment. Those who had detoxed and made it to treatment didn't last. And then we were finding the ones that came home after abstinence-based treatment were overdosing and dying on this, because they were thinking they were using the same amount of opioid that they were using prior to treatment. And when they came back, their tolerance level was lower, but they used the same amount. So we had more overdoses after, more deaths due to overdose after after they returned from abstinence-based treatment. The other thing is that they refused to try again the abstinence-based model because they felt like failures. So all around, it's a very difficult thing, and we just found it didn't work for our way. And you know, there still is in most of the provincial treatment centers, it's still abstinence based, and so it's still a difficult journey for people who want to you know, who want to recover.
Yeah, absolutely. One of the tone of all this was so gentle, Maya, like throughout, like, and I think it's just a reflection of you as a human being. I'm curious, like, how you walked in those spaces with people having conversations about harm reduction when maybe they have very strong views about abstinence being the way to go when it comes to substance dependencies.
Yeah, I realized that there's a lot of a lack of communication that happens, and when there's no communication or not enough communication, there's often opportunity for misinformation. And I spent a lot of time just sitting and listening to people. I think I probably spoke with hundreds of people, mainly from my community, and then also people working in the downtown east side, and people who benefit from harm reduction services, and people living with active substance use disorder. And I really came to understand that there's a wide breadth of understanding that's informed by lived experience in many cases. And so a lot of the times when people who were very kind of firmly rooted in the abstinence model, especially with, you know, the 12-step programs, the Red Road to Wellbriety stuff, a lot of that came from, you know, our community's historical relationship to alcohol, and the way that the abstinence model has worked for people who have lived with alcohol dependency. And so I had to come in with that understanding that their opinion and their perspective is informed by lived experience, and they have seen it work in their case and in many, you know, family members' cases. And so I had to respect that opinion and that understanding, because again, abstinence does work for some people, and I think it's important to acknowledge and respect that opinion and have it be something that's valid and considered at the table. And as a filmmaker, I felt like, and a community member, I felt a deep obligation to respect the lived experiences of all of my participants, regardless of where they came at it when it comes to harm reduction, especially because harm reduction is one of those very divisive, contentious issues, and so much of that just has to do with a lack of understanding, or just recognizing that harm reduction can take on a variety of forms, and that harm reduction shouldn't just be the end all and be all when it comes to thinking about recovery. And so, yeah, I had to kind of consider all of those things when telling this story. And I think it's really important to honor all of those lived experiences when we talk about finding a road forward. And something that I felt was really important as well was just to recognize that so often people who have experienced substance use disorder, or have that lived experience, they're often left out of the conversation when it comes to finding solutions. And that lived experience is so valuable. And so I thought it was also important to think about the abstinence-based model, those people who come at it from that lived experience, and to also recognize and value their opinions when bringing that to the table, because it shouldn't be discounted. You know, a community is made up of so many voices and so many experiences, and I wanted to be able to reflect that in a way that wasn't disrespectful of what everybody brought to the table.
Yeah, I think that really came across, and I mean, never pan-Indigenize, and also I feel like there is a distinct conversation among Indigenous communities around how they're contending with histories of trauma, ongoing trauma, and how those intersect with substance dependency. And I think people who watch the film know about the sort of knowledge translation that came from the Downtown East Side into Kainai. And I want to ask you, Mel, watching from your territory and seeing that translation from the Downtown East Side of Vancouver to Kainai, what sort of wheels are turning in your mind when you think of your own community members and what they need, have, don't have?
My takeaway that was strongest from watching this film has been, can everybody hear me? Okay, great. I just didn't see what was going on with the screen. So I had very powerful takeaways from the film. I think the biggest is that there is a big difference between urban centers and rural and remote centers. And here in our rural and remote areas, an ambulance may take up to 45 minutes to get to a space where an overdose may be occurring. There are other overdoses in our region, including alcohol. And I really enjoyed seeing the use of managed alcohol programs. And one of the other things that I took away was the contrast in which urban centers and rural centers face when we see an urban center closing spaces that are meant for harm reduction. It's very difficult to see and hear about, but it lends opportunity for community to do more in terms of our answer to a complex, ongoing, genocidal traumatic stress disorder that we face as Indigenous peoples. I'm not a person who believes in the term complex post-traumatic stress disorder because genocide is ongoing. And until we stop the genocide, we will still see the traumas occur. We're not in a drug crisis, we're in a trauma crisis. And the traumas that our people face, because they're ongoing, it's very difficult to help our people to get out of the situations they're in or improve their situations. And so as a service provider in alcohol and drug counseling for the last 5 years, I've operated with counseling for the last 27 years. My longest term in which I served counseling for community was residential school survivors. I operated in counseling for them for about 10 years in our region. And almost all of them were people who struggled with addictive substances. And when I first began this work, I did witness that our rural and urban communities had some pretty strong advocates for harm reduction services, but they felt alone. They felt that there was only 10 people trusted with harm reduction services in a small community like ours, when we need a few hundred. We need to make the terminology and language for harm reduction like people first language and other changes that reduces stigma. And I really related when I saw that there was an argument that we need to see a full range of services in our communities as opposed to just the abstinence-based models. I don't speak against the abstinence-based model. I believe in it, that it can work along with the harm reduction models. And but the biggest struggle I have is our villages. A lot of them decline the use of harm reduction services as they may only believe in the abstinence-based model. And so to try to convince our outlying areas to adopt harm reduction language and services, it's been an upstream swim, much like our upstream swim against colonization and genocide. And so the other piece is we're making headway in educating our health services. The local hospital accepted me to give a presentation regarding indigenizing harm reduction and decolonizing addictions. as well as learning more about how they can assist us in promoting more harm reduction services. The other piece that I think I took away from this is, again, the need for a full range of services, including culture, housing, healing, land back, detox, harm reduction services in our community, and along with the abstinence-based model. So the full range of services is something that we really lack here. In BC, the only recovery homes that are available to people who choose to use substances or people who struggle with addictive substances are in the Fraser Valley and Lower Mainland. So we need to see that change in the rest of our communities where we can have recovery homes available to people who are leaving their struggle behind and becoming living or lived experienced peoples. So I thank you again for the film and for involving me in this panel. I'm learning a lot, listening to you all. I'm thankful. So it's Natalia. Awitsa.
Mel, I'm curious if there's anything, since you're here as a panelist, that would be helpful for you to ask to Dr. Tailfeathers directly around things that you're thinking about that they've done and that may be helpful for you to take away and perhaps other people who are listening tonight.
I think when I made that argument that we're suffering from complex, ongoing, genocidal traumatic stress disorder, I've been studying mental health histories with Aboriginal and Indigenous peoples, and some of the argument is that we require complex post-traumatic growth. I think if we were to see a counteraction to the genocide that our people face ongoing, how would we create complex, ongoing, genocidal, traumatic growth in our communities, which is like the opposite direction? I think what I mean is, as powerful as the genocide was, that's how powerful we need the healing to occur. So the creativity that you might see in the future, we're very creative peoples, and it feels like we can create a sovereignty around our security for all things like housing. So they're no longer a full range of services, they're a full range of responsibilities. What creative process would you like to tap into to see that happen?
You're right. You know, the traumas are ongoing, especially with people who are currently actively using, because, you know, they experience it, you know, multiple times a day, you know, wherever they try to seek help, even being, you know, said, you know, I have a lot of experience with the people here in Lethbridge who have left the reserve for how or whatever reasons, and the ongoing, even though, and a lot of them are physical. I mean, you heard Lloyd in the film, and then the part about the gentleman who was murdered, and it was only the first or the second hate crime in Canada. And I'm glad that Maya had put that in the film, because we are daily struggling with that. I mean, it's multiple layers. One is just trying to heal, and the second is, you know, getting in the assaults, you know, daily, and just never being able to get rest to get to a place of rest from all of that. Like, when does this person get to rest, and when does their soul get to just be at peace? I mean, outside of dying, when are they at peace? And a lot of them say to me that they're that they use because it's the most love they've felt, and you know, and they escape all of that. So certainly, you know, what is going on is also escaping every kind of hurt that they've had just for a few minutes, and then it's compounded by everything else. So I think that it's a very complex question. One is, in the discussions that we're having right now, we've had other places across the country. We've had discussions in our in Cardston, which on the other side of the road at the edge of the reserve is a community that's completely abstinent. They don't understand alcoholism. They don't understand drug abuse, because the Mormon religion is a completely abstinent religion. And so we had a very, very difficult conversation after the filming in the theater, but I was really happy and surprised with the amount of giving and people wanting to listen and recognizing that, oh, this historic trauma is the reason why we have people downtown. And so the beginning of this is using as much education as we can to start showing people that racism and genocide has caused this harm, and the day and we as Indigenous people know that, and we try in every way possible to help our people. But as long as the harm continues, so will our addictions. So I think that it's not just the responsibility of Indigenous people, but it's a responsibility of our whole country and society to take this on and say, okay, we need to think out of the box in order for us to actually look at recovery. It means the recovery of people in Canada as well, even if they're not using.
Yeah, to that point, the urban and like in community contrast was really prominent in the scenes, Maya, that you filmed in Cardston and in Lethbridge. And, I imagine we have a lot of urban people who are here listening, people who have power in academic spaces, in community spaces. And I wonder, what you would task them with in terms of seeing what people living on their own territories are experiencing in urban areas, and like where they can use their power as perhaps non-Indigenous people trying to leverage their power on other non-Indigenous people.
Well, in the city of Lethbridge, there's been a major shift, largely due to the United Conservative Party of Alberta cutting funding and reducing funding for harm reduction services. So when the supervised consumption site in Lethbridge was closed and most of Arch's services were shut down, it had just deeply harmful ramifications on our people, because many of our people were utilizing that site and the services of Arch's, and the death rate due to drug poisoning or overdose skyrocketed in the city. And a lot of that harm had to do with deeply entrenched racist and often discriminatory attitudes towards people who use drugs within the city of Lethbridge. And so I think in terms of what I can urge people who live in urban centers to do is to put pressure on policymakers, to put pressure on elected officials to support harm reduction initiatives, because politicians have the power to make these choices, which literally have life or death results on the situation for a lot of Indigenous people and drug users in urban centers. And so the situation has changed drastically in the city of Lethbridge. If I were to go and make the film now, it would be a completely different film. And it's painful to see. And the Sage Clan and many people who are volunteering their time on the front line are doing like essentially triage work in terms of trying to help people who are houseless on the streets of Lethbridge and who are living with substance use disorder. And it's just so evident that that shift has to do with the closure of that supervised consumption site. And I think that that's something we're seeing in cities and towns across Canada. So yeah, I would urge people who live in urban centers and just Canadians in general to push policymakers to push elected officials to support harm reduction initiatives and to find ways to get education into community settings like this. I think it's wonderful that we're having conversations like this, because all it takes is conversations and shifting attitudes and reducing stigma towards substance use disorder and towards people who use drugs.
I also, there's a shout out to a couple people who sound like Vanessa Gladue saying she was in the kind of Healing Lodge when they filmed I See Myself is Lost. Now I'm an outreach worker in inner city Edmonton. I truly believe in harm reduction, safe supply. Amazing. Thanks, Vanessa. And there was also a woman, I wrote her name, but I can't get all the notes, Kate McNeil, who said she used to work with Arches. So a real interesting crowd of humans here. I think on going to you, Lori, like one of the things I think that was really prevalent in the film throughout, and to Maya's first point was like so much she was seeing was deficit based around like how the opioid crisis was being portrayed in Kainai, and looking to like shine a light on all the people doing incredible work. And if anything, the deficit shift lens really looks at these urban spaces that aren't showing up for people who are in need. And another theme that stands out to me was this sense of safety in the healthcare system, especially for Indigenous peoples, and then layer on things like substance dependencies. My question for you is, what are the signals to you in a healthcare setting that like this is a safe space that you can just show up as your whole self and get care? Yeah.
Safe place for me. It's kind of a tough one for me. Well, you know, Dr. Tailfeathers she's a very understanding woman, you know, being my doctor and everything, you know. She was dealing with a lot of people, you know, in our community, knowing where everybody was coming from. So by the time I was getting myself clean, you know, I felt very comfortable with her because, you know, she just understood where I was coming from, you know. I know a lot of people were really ashamed to come out and say that they were on drugs, you know, that they were addicts, you know. For me, I was really ashamed, you know, because I was dragging my kids all over, you know, around with me, my daughter and my nephew at the time that I was taking care of. So Dr. Tailfeathers was very understanding. I'm sorry if I'm not answering this properly.
No, that's okay. I mean, sometimes it's not simple. I just think it's such an incredible thing to have Dr. Tailfeathers in the community. So many communities don't have like one of their own working there that they can go see as their primary care physician. And I just wondered if there were things that signaled to you that like, okay, this is a safe space where I could just show up and get healthcare, as opposed to having to self-edit and worry about like how I'm going to be perceived by this healthcare provider that I'm interacting with.
Yeah. There was, see, for me at the time when I was trying to get myself clean, you know, there wasn't too many places, there wasn't too many resources in our community. You know, our community is very small where we were staying, you know. Thankfully, you know, we have a health center there and a doctors there. And thankfully, you know, Dr. Tailfeathers was helping people struggling with their addictions, you know. And for me, like I said, I was scared, I was ashamed. But when I had met with her, you know, she was my doctor before that, but, you know, I never ever expressed my addiction to her until, you know, like I said, somebody helped me and got in contact with her. And, you know, that first meeting I had with her, you know, I just knew, you know, this woman is someone I can open up to. You know, she's very understanding, you know, she's understanding where I'm coming from. And so for me at that time, that was the only safe place I knew I can go to. I can talk to her about anything. She was very understanding. She was very encouraging. She was very, she made me feel good about myself, knowing that I was an addict who was dragging my kids around, you know, that that I was able to help myself to help my kids. As long as I was willing to put in the work to help myself get clean. And after that, you know, I started, like I said, I knew a lot of people at that time who were scared to go to her because they felt like they were going to be judged. And I just told them how it was, you know, like she's not a judgmental person. She'll understand where you're coming from, you know. Don't be afraid. You know, it's not like we can just get in a vehicle and, you know, go somewhere and look for, you know, a place where there's resources. A lot of us were on foot, you know. So I'm just very thankful Dr. Tailfeathers was there to help me and help others, you know. Sorry.
No, thank you for you know, I think Laurie, your words put into, and as Maya saying, the people with the lived experiences do have, like, it is it's your story to tell, and we're so lucky and fortunate to have somebody willing to share that part of their life. Like, you know, not very people show up and like share their health records with the public. So thank you for doing that. I appreciate that. And, you know, I just think thematically too, it really makes me think of, for those who haven't read, like Mary Ellen Tupelafon's work in BC in plain sight about the history and the ongoing issues of racism in the healthcare system and the way that shows up in the importance of creating safe spaces for people to go and get the healthcare that they're entitled to and deserve. Dr. Tailfeathers, I'm wondering if there's anything, because I know there's a lot of healthcare folks in this space, that you're hoping they're going to take away from this time together after watching the film and this, you know, very brief conversation about very big topics.
I quickly interrupt. So I just wanted to point out there's a ton of thank you, Laurie. Thanks for sharing, Laurie. Lots of people commenting. I don't know if you're seeing it in the chat. Take a look.
All the thanks.
Lots of people are thanking you.
Yeah, thanks, Laurie. It's very brave of you to have to share like that. Yeah, I forgot the question. What was the question, Chantal?
Oh, just to leave folks with something to think about, to take away from this conversation that you hope they can carry into their lives and their worlds around this very brief conversation, big topic, and seeing your film.
I think one of the takeaways from this is, I mean, we saw, I think 4 or 5 years of filming. So, you know, we kind of did so much in that period of time, but when people get all like confused as to where to start, I mean, start where your community needs you to start, but we started with saving lives. I mean, you got to save lives. So harm reduction is number one. Hey, naloxone, CPR, you know, recognizing that people should not be using alone are like the first steps. First thing you have to do is save lives no matter what. And then we move on to other, move along the spectrum with opiate replacement therapy. Don't be afraid to discuss safe supply, although in Alberta it's really difficult to do that. But safe supply is a good way to cut out the dealers and all of the crime that goes along with it. So we really need to take that seriously. And then looking at, you know, medical detox. It's a very humane way of helping people through their, through becoming stabilized on opiate replacement therapy. And within that, I saw a question here about recognizing methamphetamine withdrawal. And we know that the drugs that are being sold are increasingly more and more potent with other drugs, such as the benzodiazepines like Ativan and what people call Xanax and that. So one injection might not just have just opioids, but it might have a whole range of drugs in them. And we've seen that progressively get worse. And with the methamphetamines, we find that as soon as you've reversed a withdrawal with naloxone, and it's the opiate that the naloxone is taking care of, then the other drugs come through. Sometimes we have a difficult time reviving them because there's still a lot of benzodiazepines on board. So they'll continue to have difficulty breathing. So CPR is so very important if you don't have EMS right available. And then recognizing that once those immediate withdrawal effects are gone, the effect of the methamphetamines come through. So we see lots of paranoia. We see lots of, we're seeing more and more violence because people are not recognizing where they're at and what's going on. So we've had to use increasingly more and more antipsychotics. We're using injectable Halidol to help. And we have, because it's a medical detox, we use partial sedation. So they're partially sedated for about 72 hours so they can sleep through the worst of their withdrawal. And then we start them on the opiate replacement, but the psychosis still comes through. So we may end up having to use antipsychotics, and we go as far as using something called Clopixel to help people settle from the methamphetamine withdrawal. So it's getting more and more complicated to treat medically the withdrawals that we see. So I'm totally on board with Mom Stop the Harm in terms of safe supply and taking a look at decriminalizing, drugs, because what we have to do is we got to get smarter than the dealers, and the dealers are getting smarter than us, and it's a whole cat and mouse game, and it will end up being horrible if we don't get ahead of it. So let's get smart and outthink the dealers.
Got a lot of call out there, that comment, and I could talk to you all about this for a long time, but one, I'm not supposed to have this many people in my apartment because of COVID restrictions, and two, we're like meant to end at 7 o'clock. So I do regretfully want to sort of close out the conversation. Mel has generously offered to close us out with a Wet'suwet'en song, but before I throw it to him, and maybe any other final thoughts you want to add, is that please, in the spirit of reciprocity, do keep an eye in your emails for a survey that's going to come your way from Story Money Impact. I've also heard from Tamo that included in that email, or maybe a separate email, there'll be a resource sort of email with a lot of information for folks. There's lots of questions, and of course we barely scratched the surface on so much of this tonight. So please keep an eye out for your emails. Please do the survey for the sake of everybody here, and sort of giving back for the time that everyone gave tonight. And yes, share the film with your friends, have these conversations, write down people's names who are here, and keep networking to save lives. And thank you all for being here. Mel, I'll throw it to you.
Natalia, for asking me to offer a song to assist with closing. One of the closing comments I might have is I'm so thankful for the Gimabitan film, and it got me wondering which song I wanted to share. And so throughout the discussion now, I came up with the idea to sing a Bear Clan song. And in this Bear Clan song, we have the story that goes with this song is that when our hunters approach a bear den, we must approach it with the greatest humility, because the animals can sense us when they come around. And quite often they give their lives to us so we can survive. And that fulfills their responsibility and purpose in this world. And so in this song, it's an approach to a den of a bear. And in our culture here, the bear is very much a representation of motherhood. And so I thank you for your motherhood and portraying it. That's for all of you, Esther, Maya, and Lori, and all the rest of you who are moms. My question earlier was about complex answers to complex problems. And so the creative part that I'm working with is inspired by the clan patrols across the East. We created all clans patrol. A bag full of naloxone kits, first aid kit, radios, and we have a headquarters upstairs, a client peer space, a space purely for clients to answer the triple health crisis that we're in. I would call it a triple health crisis because of the re-traumatization that we're currently witnessing as Indigenous people with the residential schools finding the children. And so with 11 schools, we've discovered 10,000. So we all knew this truth. And that complex answer, I think, that we're all after, it's in our communities, it's in our moms, it's in our matriarchs. And so I would like to honor all the moms on this call and my own mother. She taught me how to be in this role. This is the Bear Clan song. It's called Wadum Debts. Wadum Debts to Wadum Debts to hey ha hey hey ha hey ha hey hey ho hey ho hey ha wa ha ha hey ho hey Wadum Debts to hey ha hey ho hey ha Wadum Debts to hey ha hey ho hey ha hey ha hey hey ho hey ha hey ha hey hey ho hey ha hey ho hey ha wa ha ha hey ho hey hey. It's Nakalia, Kimapipitsin, and the people of Kainai, and to all of you who joined us, and for the prayer earlier, Francis. We must continue to create. We need to critique, create, and confront our oppressors and the oppression. That's a full range of response to genocide. Critique, confront, create. And I think it's that creative process where we no longer need to counteract genocide. And it will come from empathy. Autsa, thank you.
Thank you for your song, and Maya, for your gift of this creative way of expressing this conversation and getting this started.
Thank you, Mel and Chantel and Lori, Mom, Francis, Demo, Jocelyn, Story, Money, Impact, everybody who came. It was a really wonderful and short conversation. Good night.
Is this thing still on? It's hanging up on a Zoom call is, I still, 2 years into this pandemic, still haven't figured it out. It's kind of just like throw your laptop, like cover the camera. Yeah, we're all just gonna make awkward exits now as the credits roll.
Okay. Hartstikke suka. Kijk maar.
Good
Bye.
Oh, yeah.